Hi, hello, welcome back. So today we will be seeing about endoscopy procedure, the code series 33269 to 33274. This is a topic which is coming under CPT cardiovascular. We have added a playlist for all the CPT topics. Please do have a view so that you will have a proper understanding. Definition for this is endoscopy procedure with code range 33269 to 274 involve minimally invasive technique to visualize and treat condition affecting the heart. These procedures are performed using an endoscope, a flexible tube with a light and camera attached to it. The CPT code range for these procedure is 33269. It is an unlisted procedure. 33270 insertion or replacement of a permanent defibrillator with endoscopic approach. 33271 is for repositioning of the previously implanted defibrillator. And 33272 is for removal of permanent transvenous pacemaker. 33273 is insertion or replacement of transvenous pacemaker with endoscopic approach. 33274 is insertion or replacement of subcutaneous defibrillator with endoscopic approach. So example here is case of subcutaneous implantable defibrillator insertion. 45-year-old male with history of ventricular fibrillation. Here the insertion of permanent pacemaker is done through endoscopy approach. We are giving 33270. Case 2, a 60-year-old female with a pacemaker lead dislodgement. Procedure repositioning of previously implanted transvenous pacemaker lead. So we are giving 33271. Example 3, case of lead removal. Patient 65-year-old with an infected pacemaker lead. Procedure done is removal of permanent transvenous pacemaker lead. So we are giving 33272. Example 4, case of lead replacement. A 55-year-old female with malfunctioning pacemaker lead. Procedure insertion or replacement of transvenous pacemaker lead. So we are giving 33273. Fifth example, case of subcutaneous lead replacement. A 50-year-old female patient with subcutaneous defibrillator and lead failure. Procedure insertion or replacement of subcutaneous implantable defibrillator system. So we are giving 33274. Tips for coding, we have to go through the documentation very clearly, that specifying the endoscopic approach and the type of device or lead being manipulated are clearly documented. Correct code selection should be done based on the insertion, repositioning, removal or replacement. Stay updated with the guidelines, understand the equipment used. So that's all about this topic. For clear understanding, you have to go through each examples very clearly so that you will have a proper idea of how to code this procedure. So that's all. Thank you so much for watching. If you haven't subscribed my channel, please do subscribe, and if you find it interesting, please do share it with your friends also. Stay tuned so that you will be getting regular update of all the CPT procedures. Thank you. Take care. Bye bye.